welcome to another video on the channel. Today, you'll discover the 12 signs of cancer most often ignored by women. It's widely known that cancer can develop silently at first. Even women, who typically take better care of their health than men, can miss some important signs. But after all, which symptoms deserve extra attention? Let's find out now. 1. Unexplained weight loss. Losing weight without dieting or exercising may seem positive to some women, but it's important to be vigilant. When there's no obvious cause for weight loss, it could indicate something more serious. Cancer cells often consume a lot of the body's energy, resulting in involuntary weight loss. Hormonal problems, such as thyroid problems, can also be responsible. 2. Persistent abdominal bloating. Many women associate abdominal bloating with PMS or their menstrual cycle. However, if this feeling of distension persists for weeks, it's best to seek medical advice. It could be an indication of ovarian cancer or other more serious problems. Symptoms such as pelvic pain, discomfort, even with ingestion of little food, frequent urination, and a feeling of fullness also deserve attention. In certain cases, fluid accumulation in the abdomen puts pressure on organs and even interferes with breathing. 3. Breast changes. Performing regular self-examinations is essential, but not all signs of breast cancer are limited to lumps. Other worrying signs include redness, itching, spontaneous discharge, an orange peel appearance, sunken nipples, or changes in their position. An annual mammogram is recommended after age 40, while an ultrasound can be performed before that. Any hardened or unusual-looking nipples should be evaluated by a specialist. 4. Bleeding outside the menstrual cycle. Women with regular cycles should be concerned if bleeding occurs outside the expected period. For those who have already entered menopause, this is even more serious. It could be a symptom of endometrial cancer. Bleeding from the anus, often confused with hemorrhoids, could also be related to bowel cancer. 5. Skin changes. Non-melanoma skin cancer is the most common type of cancer in Brazil. Be aware of moles and spots that itch, bleed, or peel, as well as signs that change shape, color, or size. Sores that don't heal for weeks are also suspicious. Because melanoma is quite aggressive, it's essential to see a dermatologist if you notice any unusual changes. 6. Difficulty swallowing. If you feel like swallowing has become increasingly difficult, this could be a sign of stomach or throat cancer. The presence of a lump in the neck, accompanied by weight loss and pain when swallowing, could indicate a tumor. The mouth and throat contain different types of tissue, where various types of cancer can develop. 7. Blood in unusual places. Blood in the urine can indicate a kidney problem or a serious urinary tract infection. Anal bleeding, while sometimes linked to hemorrhoids, should not be ignored, as it could indicate colon cancer. Anal cancer, while rarer, usually manifests with bleeding and pain, especially during bowel movements. It is more common after the age of 50 and among people with HPV or HIV infections or who engage in anal intercourse. In most cases, the presence of blood in the urine is usually the first sign of bladder cancer. In some cases, the amount of blood may be so small that it doesn't visibly change the color of the urine. When the volume is greater, the urine may take on an orange hue or, in less frequent situations, a dark red color. 8. Digestion problems. When indigestion occurs without being related to common factors such as pregnancy or excess weight, it's important to be alert. It could be a sign of cancer in the esophagus, stomach, or throat. Warning signs should be raised, especially if these episodes become repetitive. Initially, symptoms typically include difficulty digesting, a feeling of heaviness in the stomach after meals, constant heartburn, mild nausea, and even a lack of appetite. 9. Visible changes in the mouth. The appearance of white spots or whitish lesions on the tongue may be a sign of a premalignant condition called leukemia, which has the potential to develop into oral cancer. This condition is more common in smokers. If you notice these changes, it is essential to seek medical advice from a dentist. Leukoplakia is characterized by thick, white or grayish areas, usually located on the inner cheeks or gums. They often have raised edges and a hard texture. 10. Changed lymph nodes. If you notice persistent swelling in your armpit or neck, it may be a sign that something's wrong. When a lymph node remains enlarged for more than 4 weeks, it's time to see a doctor. It may simply be an inflammatory response to an infection, but it could also indicate a tumor. Under normal conditions, lymph nodes are small and discrete, but in cases of infection, inflammation, or cancer, they can enlarge and become visible or palpable under the skin. 11. Loss of appetite. Some types of cancer, such as those affecting the ovaries, pancreas, and stomach, directly affect metabolism, leading to loss of appetite. This compromises nutrition and causes severe weight loss, including loss of muscle mass. It is estimated that between 80% and 90% of people with advanced cancer experience this loss of appetite. 12. Back pain. Although back pain is not usually the first symptom of cancer, it can indicate a more serious problem when it persists for no clear reason. Therefore, doctors recommend regular checkups to detect tumors early before they can spread to other parts of the body. With all this information, it's clear that even symptoms considered trivial can actually be warning signs of cancer. Therefore, it's essential to keep up with your checkups and not ignore any unusual discomfort. We'll end the video here. If you enjoyed the content, please like it, subscribe to the channel, and share your opinion in the comments. Best regards, and see you in the next video.